In this video, you will hear a consultation between Robert, who is a 63-year-old patient, and his consultant urologist discussing the UroLift procedure for prostatic enlargement.
We are here to discuss your upcoming procedure of UroLift, and I am happy to answer any questions you might have.
Thank you, doctor. What does this procedure involve?
Your prostate gland sits around your urethra, water pipe, as it leaves the bladder, and when it enlarges, it can block the flow of urine. The UroLift procedure involves passing implants into your prostate, using a telescope passed into your bladder. The implants are placed between the inner and outer surfaces of the prostate, so that they pull the obstructing prostate lobes away from your urethra. They become incorporated into the prostate tissue within 3 months, so they cannot be seen in your bladder after that.
Is the UroLift procedure better than other surgical procedures on the prostate, like TURP, for example?
The main benefits of this procedure, compared with other surgical treatments for prostate enlargement, are a short stay in hospital, a minimally invasive procedure that be done under local anesthetic, and patients can go home the same day. The procedure has no sexual side effects, such as retrograde ejaculation, which is a dry ejaculation, or erectile dysfunction. Your urologist can tell you whether the size and shape of your prostate means that this procedure is suitable for you, but it cannot be used in all men with prostate enlargement.
What are the alternative options?
Conservative treatment, restricting your fluid or caffeine intake to improve your urinary symptoms and help you avoid surgery. Drug treatment, using either finasteride to shrink your prostate or drugs which relax the muscles in the prostate, for example, tamsulosin, to improve urine flow. Transurethral resection of the prostate, TURP. This entails removing the central, obstructing part of your prostate with electric current, using a telescope passed along your urethra. Holmium laser enucleation of the prostate. HOLEP. This entails removing all the obstructing prostate tissue with a laser, using a telescope passed along your urethra. Photoselective vaporization of the prostate. Green light laser prostatectomy, using a different type of laser to burn away the obstructing prostate tissue, using a telescope passed along your urethra.
What happens on the day of the procedure?
Your urologist will explain the surgery and check your health. The anesthetist will talk about anesthesia options and pain relief. You may get special socks and an injection to stop blood clots. You'll get antibiotics to prevent infection after checking for allergies.
How is the procedure actually done?
We put a telescope into your bladder through your urethra. We put several implants into your prostate through the telescope under direct vision using a special applicator. We do not usually need to put a catheter in your bladder at the end of the procedure, which takes 10 to 15 minutes to complete.
Are there any after effects?
Common after effects: temporary burning or stinging during urination. This affects about 34% of patients. It typically lasts 5 to 7 days. Temporary blood in urine. This affects 26% of patients. It typically lasts 5 to 7 days. Pelvic pain or discomfort. This affects 18% of patients. Less common after effects: persistent symptoms requiring further treatment. This affects 13% of patients within 5 years. Urinary urgency, sudden need to pass urine. This affects about 7% of patients. Temporary urge incontinence, leaking when needing to go. This affects 4% of patients. Inability to pass urine, temporary retention. This affects 3% to 5% of patients and requires short-term catheter use.
Are you able to summarize the benefits of the procedure for me, please, doctor?
1. Effective symptom relief. Most people see significant improvements in urination symptoms and quality of life, faster than resin, for example, with benefits lasting up to 5 years. 2. Preserves sexual function. UroLift doesn't negatively affect sexual function, including erections and ejaculation. 3. Faster recovery. The procedure is quicker, with many patients going home the same day with no need for a catheter insertion in most cases. 4. Improved quality of life. Most patients report feeling better and experiencing fewer symptoms after UroLift. Compared to TURP, UroLift has a shorter recovery time and avoids many of the risks associated with surgery like bleeding and erectile dysfunction, though TURP may improve urine flow slightly more in some cases. Resum, steam therapy. UroLift provides faster symptom relief, but costs and recovery times can vary between the two treatments. Conclusion: UroLift is a safe, effective, and minimally invasive option for treating BPH. It offers long-term symptom relief, protects sexual function, and allows for a quicker recovery compared to traditional surgeries.
Thank you very much, Doctor, for this comprehensive summary and for explaining the procedure and how it compares with other surgeries very clearly. I feel happy to proceed with this surgery, and I feel it is a very safe option compared with other surgeries.
This is the end of the video. Thank you for watching. If you are new to the channel, please consider sharing and subscribing to help the channel grow. See you in the next video.